Hi, I'm Dr. Ria Hogseth, founder and director of the Pediatric Dental Team Association. This practice pearl has some great tips to help your clinical and non-clinical team members carry out their duties that are now required based on COVID-19. These tips are just to help them find easier ways to disinfect your office, make their PPEs more comfortable, and just some other general tips that will help make this transition much easier for you. So in your pediatric dental office pre-COVID, people had toys out in their reception area. They had things for the kids to play with, toys to keep them occupied while they're waiting. Now we want them into the office as fast as we can and taken back to their treatment area as fast as we can. It wasn't uncommon also to have one of the staff come out to greet you and get the patient.
Good morning, Miss Jones. We're ready for you. Come on back.
So now when you come into a pediatric dental office after COVID, you will have a greeter.
Hi, Ms. Jones. Let me take your temperature. Hi, Susie. Let me take your temperature as well.
And you'll notice now that the reception area has been cleared of all toys and any materials, books, magazines, everything should be put away so it is much easier to disinfect and keep clean. You could have a box of Kleenex, although I recommend having more individual packets for people who have colds or allergies if they've been okay to come in. You can also have a nice sign here that says what to do if they are having any of those symptoms of a cold or allergy, and also have out your hand sanitizer. However, make sure that there is some in there. This one is pretty much empty and sitting out, so you want to make sure that somebody in the office is designated to check on those supplies and make sure that there's plenty of them set out around the office. You also want to make sure that you are using hand sanitizer that has a pump and not one that they have to pick up and squeeze out. You don't want that kind, you want the pump kind for that hand sanitizer. So your office might have a greeter at the door who scans everybody there or not. Some offices are doing it at the front desk area.
Good morning, Ms. Jones. Good morning, little Susie. I'm going to take you guys' temperature. And also we have a COVID-19 questionnaire that we would like to fill out. Do you have a fever or felt hot or feverish recently in the last 14 to 21 days?
No.
Okay. Are you having shortness of breath or other difficulties breathing?
No.
Okay. Do you have a cough?
Miss Jones and Susie? Hi, Susie. How are you today? Are you ready to go get your teeth tickled? All right, thanks. Come on.
So in this environment now, you will see that the clinical team now has to wear the full gown, a head covering, a COVID-19 mask, N95 mask, a full face shield, gloves, and are completely protected barrier-wise. You also want to notice that you want the area decluttered as much as you can so it's easier to disinfect. So you don't want a bunch of things out on your countertop, and you want to make sure it's easy for things to be cleaned. So even gloves and your cleaners can be put away in a cabinet, and that will make it much nicer. So bringing us into the treatment area, this is not what you want to see in your treatment area. You do not want your gloves out, equipment out, sunglasses, all these things that are out. It will make it harder for you to disinfect between patients. So you want it as uncluttered as possible. So open up in cabinets, put things away. As much as you can, just find areas where you can do that and just put them in drawers and or cabinets so that everything is clean and clutter-free. Some people are keeping their wipes out. You just want to make sure, if you do, that you are wiping the wipe container after you take things out. Nitrous tubing should be replaced in between each patient and either use autoclavable or disposable tubing. Your keyboards can be covered with either a plastic wrap, such as this, or you can use a shower cap, such as the kind you find in hotel rooms. You can also buy them on Amazon, and just take that and pop it onto your keyboard, and you've got it all protected, and it's got some give to it, so it's a little bit easier for typing purposes. And then just take it off when you are finished, and just throw that away and get a new one and replace it. Quick and easy change out for your keyboards. So this is more of a clutterless office, that treatment room, operatory that you would like to see. Most things are put away, and you bring them out as you need it to set up for your patient. Even your crowns and bands and things could probably go in a cabinet and just bring them out for whatever patient you need. If you are using napkin holders, you probably want to consider using disposables for those also. So once the patient comes in and you know what treatment's going to be done that day, then it is great to be able to set up the room and get it all prepared with the equipment that you need to minimize your going out of the room and or opening any cabinets once the procedure has started. So here are some modifications to help keep your clinical team a little bit more comfortable, and Emily's going to tell you what she has done.
So underneath my hair cover, I have a headband that I have purchased and have sewn buttons to help with the elastic to keep it from pulling on the ears and making it uncomfortable for wearing it all day. There are different ones that you can buy. You can buy the head coverings that have the buttons on them that are great as well. Just some of them, the buttons are in different positions, and it may make the mask a little bit tighter depending on what you're wearing and how you're wearing it. So you can adjust it accordingly as needed. The headbands that I used for this, you could probably find anywhere. I was able to find these on Amazon. Just a basic cloth headband. My buttons I purchased from Hobby Lobby. I wanted cute ones. So I sewed cute buttons on there for all of my girls at the office I work with, just to kind of help give us that relief. I did the buttons on my headbands because this around here on this area of my ear is dry and patchy from the elastics and everything rubbing up against it.
So now we're required to wear the N95 mask, and because we have a shortage, we have to wear them for the whole day. So what some of us do is we will wear the mask, and then we have to put this on top of it, like so. But this can put a lot of strain on your ears. So what some people have done is sewn a headband. They've gotten a headband, they've sewn buttons to it, and they put it on top of this, and they just hook them on top so it takes the pressure off your ears. Or you can take the buttons and sew them directly onto the cap. In fact, I have one right here. This is an example of a headband that one of our wonderful assistants had made that you just put the buttons on. So if I put this on top of my head like this, then I can easily take these off and attach it, and it takes the pulling and the fatigue off the ears. So that's a really good modification.
Allow children to pick what item they want, stickers or toys, and have a team member help get it. You don't want any more a toy box that they can root through to get their prize.
To gain access to the complete checklist that we've put together, all you have to do is click on that easy button and you'll get access to this downloadable checklist. It's not meant to be as thorough as the checklist you can get through the ADA or the CDC, or even the California Dental Association has a very thorough checklist. This is just meant to have some quick, easy tips for your team to just make their new jobs a little bit easier. If you would like more easy buttons like this for your entire dental team, the Pediatric Dental Team Association has over 120 online videos that cover things for both the clinical team and the non-clinical team that are easy to access 24/7. We also offer a live conference once a year where your team can get their certified credits that they need for their annual licenses. This has been a Practice Pearl from the PDTA, and I'll see you on the next one.